also have a live web chat going on at WGME.com. Again, the number 1-877-494-6308. Now, as you mentioned, it is not just people over 60 who have problems with hearing loss. That accounts for about 40% of the population, but that leaves 60% of people who are younger with the problem, and it can start at birth. The first thing you notice about 15-month-old Easton Morin is he is incredibly cute. If you look closely, you may also notice he is wearing a hearing aid.
Thank you.
It's the last thing his mother expected he would need when he was born.
Very shocking. We have another son who was born completely normal, and then to not have it in your family at all, and then to find out your son has a hearing loss, it's pretty devastating.
Very emotional. It's really a sense of loss. A grieving process when parents are told that their newborn or their child at any age has a significant hearing problem. That image of the perfect baby is gone, it's shattered. So it's best if we can help parents get to the point of acceptance so they can move forward on the behalf of their child.
Oh, good! And that's exactly what Easton's family has done. After the newborn screening and a follow-up consultation confirmed Easton couldn't hear, his family began the process of learning what they could do.
Maybe we'll run one more, honey? Yeah.
They began with pediatric hearing tests that monitor brain waves to see if Easton responded to noise of any kind and if any hearing device would help.
Hearing loss is a permanent condition when it involves the inner ear hair cells. When they're gone, they're gone. They're not ever going to grow back. So when I talk about hearing aids as a treatment, I always emphasize to the parents that it's not going to restore the child's normal hearing. It's a substitute for hearing. A hearing aid is an aid for a reason. It's an assistive device. It's not going to be a cure.
In addition to his hearing aids, Easton also has had a cochlear implant on his left side. It takes a while to see if it will help, but Easton has accomplished a significant milestone.
He's becoming more acclimated to hearing his own name, which, as a mom, you give your child a name even before birth, and for him to just be able to recognize it is incredible. He's just an incredible little boy. I mean, aside from being able just not to hear, there's nothing abnormal about him. He is funny, and he's smart, and he's fine.
And did I mention cute? Oh, what a very special little boy and a wonderful family. And joining me now is Dr. Elizabeth Jardine, who is a pediatric audiologist. Now, Easton was screened, as is the case of almost all newborns born in hospitals in Maine. Now, for children who may have a genetic predisposition, something hereditary in their family, what are some of the signs parents can look out for that there might be hearing problems?
Oftentimes when children are born early on, we don't know unless they refer on the newborn hearing screening. Sometimes hereditary hearing loss develops when children are older, sometimes even very late onset, around age 10 or 12, for example. In those cases, what parents should look for is some delay or issue with the speech articulation or language development. When they notice those signs, that would be a very good time to get in for a hearing evaluation. Other signs oftentimes are that parents will find they're repeating things to the child, or they'll tell the child to do a certain task and the child just doesn't perform it.
And also children can become what we call loud talkers, which
Yes.
can also be kind of a symptom that they're compensating.
That's true.
What's so amazing in this field, though, Elizabeth, is that the technology continues to improve, the testing does, and there are so many things to help kids now who can't hear.
Yes. Yes.
As in hearing aids or perhaps cochlear implants in Easton's case.
Yes. In Easton's case, initially he started with bilateral hearing aids, but with his profound level of hearing loss in the one ear, he was a very good candidate for cochlear implantation.
All right, still unknown how that's working, but everybody has their fingers crossed and they've adapted so well. Thank you so much, Elizabeth, and we'll answer more questions coming up in our